everybody. Welcome to Act 3 on CHLY 101.7 FM. We are delighted that you have tuned in on this bright summer day. I know that summer is well along the way as far as the months are concerned. Hopefully, as we're going through it, we get to enjoy some sunshine without ever having any, major heat domes or anything like that. So take care of yourself and each other. Thank you so much for tuning in. Today's guest on the Zoom booth of CHLY 101.7 is Twyla Johnson. She is with Pacific Coast Healthcare Services. Welcome to the program, Twyla. How are you doing?
Thank you very much. It's a pleasure to be here. I'm doing great, especially with the sun.
I know, isn't it great when we have decent weather?
Yes.
I just
Long overdue.
It is. And I know that your agency works within community to help support health and wellness for a variety of different age groups. I'm sure that seniors are maybe a part of that, but I would imagine that there's quite a difference of age groups. Can you tell our community in Vancouver Island, Central Vancouver Island, what exactly is it you guys do?
We are a home healthcare organization.
Okay.
So we go into the community, into people's homes, wherever they would need us. So that would be in a retirement residence or their home at home. We have clients on boats that live on boats. So wherever people need care.
Yeah, and I think that care is quite an expansive conversation because some people, they feel that the care is, having the bandages fixed and, perhaps assisting with, prescription medications and giving those to particular individuals. But it's really a much larger gamut when it comes to healthcare, isn't it?
It sure is. Our primary goal is care aides, home support workers, community health workers that go in and do hands-on care with people. So if someone needs help preparing a meal or having a bath, doing day-to-day things, that's the biggest part of our business. And then we also have nurses. And the nice thing that sets us apart is, we were founded by a nurse. We're completely nurse managed and run. And we have a lot of nurses on staff that will go out and do the more complex things. So dressing changes and we even do, actually right now we are staffing the nursing at the clinic at the Victoria Airport for COVID testing. So there's, good variety and we have a small niche where we also in the office do some drug testing for like workers going up to Fort Mac or something like that, so there's a nice variety that we can do.
Yeah, you don't necessarily think about doing those medical checks for those that are working out of city, like in Fort McMurray and such. So that's really interesting. I'm curious now, specifically because we have had such a run with COVID, and thankfully I do understand we've opened a lot of it up, but I'm assuming that really impacted your services. Can you talk a little bit about what you've seen changing in this last couple of years?
Ooh, that's
I know, big questions.
Conversation.
I know, right?
So I'm the director of operations, so it's my job to make sure that all the background stuff is done and that everybody has what they need to go out and do their job. And man, at the beginning of COVID, that was pretty challenging. So there was shortages of supplies. I can't even tell you like the lengths I went to just to get gloves for our staff. And I have to, so our organization, I'm really proud of this. I'm going to brag about this.
By all means, that's what we're here to do, share information.
We were the runner-up and the finalist for the Outstanding Workplace of the Year for the Greater Victoria Business Awards through the Chamber of Commerce. And unfortunately we didn't win, but second is great. And it's because we are such a family, like we love what we do. And part of why I'm looping around to that is because when we could not get masks and it was the beginning of COVID and people were freaking out, we had both managers and spouses of managers. My husband was one, God bless him, made over 75 hand sewn masks for our workers. So it's
Wow.
like that kind of like heart is why I do this, right?
Yeah, no
But
kidding.
it's gotten much better. But yeah, I was like trying to find goggles because you couldn't get the face shields, and just yeah, it was really, really stressful. We partnered with Safe Care BC with Operation Protect and became a collection site where wonderful people in the community said, "Oh, I have these leftover N95s," and they'd drop them off, and we'd get them to the people that needed them, distributed to other home care agencies, gloves and masks and things like that. So it was challenging, but there was this wonderful community coming together thing, which was really great. I'm very proud of that. And
Well,
now it's kind of settled down. There are supplies that you can get, and we got on the central stores for our agency, which helped a lot too. There was a whole learning opportunity through not just our organization, but the government and other organizations. And so it made things a lot smoother now. But now we're dealing with, the Omicron and things like that.
right.
And, there has been, even before COVID, there was a terrible shortage of staffing for our organization, our like everybody in our community that does home care, hospital care, that kind of thing.
Yeah.
You can see now it's expanded to restaurants and other places, but now it's even more challenging because you've got, well, over the last 2 years, a worker might get COVID or COVID symptoms, and they've relaxed some of the criteria. But in the beginning, it was like if someone even had a COVID symptom, they were off work for like 12, 14 days being quarantined. And so then it's the scramble because, we obviously have to triage our client base to those that maybe have family help or can manage on their own for a few days, to those that are really relying on us for all their care.
Yeah.
We have, intense clients like quadriplegics and paraplegics and other, situations where they really are relying. And so that's been an incredible challenge, right?
No kidding. And I think it's really important that we recognize that, for many people within community, their only source of support is an external force like yourself, that there are no neighbors that can help out, particularly where it comes to, bathing and paraplegic kind of issues, things like that. I can only imagine it must have been very, very heartbreaking.
And if you
at
think
times.
about the people that live in Victoria, there's a huge, I call it the Florida of Canada, because people move here to retire, right?
Yeah.
And so a lot of times we will be contacted by family, can you check in on my mom or do this for my dad? And because they can't, because they're in New York or they're in London, or Ontario, Toronto, wherever. And their family moved out here when they were healthy and play golf and retiring, but now they're starting to have some problems, right? And so that's the hard part, is we have a huge retirement community here that is aging in place and doesn't have the family to back them up. So so that's where we can, help out, step in and help out.
So, in that frame, when you talk about, the people that were having to, if they had a symptom, they would have to take that time off. How did you manage to deal with your resources that way to be able to take care of everyone? Were you guys running 24/7? Like what was happening?
Yeah, it was challenging.
I can only imagine.
Constantly waiting for new directives from the public health officer and just trying to figure out where weeding through all the information. We have a great management team. They were, they're my support as well too. We all just sit down and go through all of the information and make sure we are doing exactly what's required, keeping everybody safe. That was, I think, really challenging. But because all of us in management are nurses, that we are used to triaging, right? The concept of triage is not new to us. And so, and we have compassion, and it's a way of saying to someone, I appreciate your understanding right now, but perhaps your laundry is not as important as, and so
no,
pulling
understood.
workers, pulling workers
Yeah.
from one place and sending them to someplace more critical. And
Mhm.
yeah, and there were times, honestly, I think, you know, VHA, everybody's experiencing not able to always fill a shift, right? So
Yeah.
sometimes, yeah, it would be, unfortunately, at this time, we just don't have anybody.
Yeah.
And it's not, to our credit, it's not the critical people that would happen to, because we would, you know,
Find
and I would
solutions
say
for
there's,
sure. Yeah.
yeah, a lot of our nurses
Yeah.
would go out and do care aid shifts too, just to, you know, get stuff done. So yeah.
Yeah. How helpful, don't misunderstand. I'm not looking for the negative in anything. I always look for the positive wherever I can.
I
But I
appreciate that.
do know that the system, when it comes to Island Health Authority, they really do try to do their best. There's no doubt about it.
Mhm.
How easy or difficult was it to work with, in partnership with VHA during, or Island Health during this crisis? Were they compassionate and supportive, or were they struggling themselves and just trying to find bodies?
Well, both. They're struggling themselves, but we have a really good relationship. We're actually one of their overflow providers. We have a contract with VHA,
Uh-huh.
so they will reach out to us when they need shifts filled. We'll fill as many as we are able to. And I just know that our schedulers and their schedulers get on really well and
Yeah.
work in harmony. So, I mean, because in times like this, that's where people's stress really comes out. And so it's important to keep that compassion and understanding, right? And it's actually gone very smoothly, I
Oh,
must
I'm
say.
glad.
Yeah, yeah.
And I'm also really curious because, there was a time early on in the pandemic when we as a community were very celebratory of our nurses and our support
Oh, yeah,
staff, right?
yeah.
And, unfortunately, over time, that's kind of dwindled away and changed. Has it changed with the mentorship within your own organization and helping these, very exhausted, I would imagine, health professionals now trying to find their way through yet another season of COVID? How are you managing with all of that?
We've always been celebratory towards our own staff.
Yeah,
And I think that hasn't changed, and that internal appreciation. The
sure.
external appreciation is wonderful. I mean, it was moving to me, all the banging of the pots and everything, right? But
Yeah,
and then it kind of turned, and you kind of, here's the thing though, I get the frustration. I totally get how we don't all agree on things, and how boring would this world be if we all agreed on
right,
everything. But
right.
I just, it's like, I try to I'll let you in on a little secret. On the side, I'm also a hypnotherapist.
Oh,
And
that
so
helps.
I
That helps a lot.
so I do get that other people have other motivations and other
Yeah,
thoughts, and it's like, you have to appreciate people where they're coming from, right? And so that sort of philosophy is where I lead from, and that flows down, and we really try to be empathetic to everybody's situation, right? No
yeah.
matter what it is. And I mean, short of abuse, right? I'm not going
Of
to let
course, of
anybody
course.
abuse our staff,
Nor
but
should you, of
no,
course.
but obviously everybody's entitled to a different point of view.
Yeah, yeah.
So
And you're quite right. I mean, that's what makes our world such an
yeah.
extraordinary place, is that we all live it in to our own terms for the
Mhm.
most part. But did you find, and no, I don't mean but, I should say and I noticed that there was still some changes and some challenges. And I'm curious about how nurses, especially now, have been self-caring, right? I love that you were talking about hypnotherapy a moment ago, but how are the nurses self-caring at this time, at least from your perspective with your organization?
It varies. Some of them have come to see me,
Oh, good.
which I think is amazing that they will do that, considering,
Yeah.
that
Let's
doesn't seem
trust,
to
right?
bother them.
Of
That
course.
I'm also, yeah.
But
But
there's something to be said for that, though. I mean, there's a level of trust that comes when you
that's
go into
right.
it,
Yeah. Yeah.
that,
Which
that is
I
there.
totally appreciate.
Yeah, yeah,
But
yeah.
we will make a point of doing things together. So
Mhm.
in our with the nursing, which deals with a lot of more really high level
Yes.
stressful stuff. Not
Yeah.
that the care aides don't, they do as well. But we try to get together you know,
Mhm.
when we can. And we kind of had our own little family bubble for, you know, a while. Now we don't have to worry so much about that, but we make a point of when staff come in, they come in for their paychecks twice a month. And we make a point of talking to them. How are you doing? Reaching out to them at other times, sending them, we have these things called wow cards. So making sure whenever they have a compliment or anything, they know that they're doing a great job. And we'll send them too, not just from our clients. Like, you know,
Yes.
you did a really good job on that. And just making sure that they know the resources out there. Like, we are unionized, so there's a really nice EFAP program, family assistance program through the union. So if we see anybody struggling, you know, what's going on, can, you know, would this be of benefit? And so just really trying to be a family, right?
Yeah. Yeah.
When they come in on payday, we put out payday treats, right? It's like
Yeah, of
everybody
course,
likes
of course.
food.
Yum, 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 which is,
Yeah.
another reason why you guys came in second for being, the organization of the year for this kind of work. And
Mhm.
this is heart work. This isn't
Yeah,
just a job, it's heart work. It
that's right.
takes so much out of the
And
nurses, I know.
the people, I notice that the people that work in the community are usually not, they're not in it for the money, they're in it
Nope.
for it fills their bucket. They want to give back, they want to give to their community, and that's why they're doing it. Usually that's their drive.
Yeah.
That's also a danger point, because when you are a giving person, you tend to give too much, right? So we
Very
try to
true.
keep an eye on people, right? And that is one of the reasons we do have, I know prior to the start, I mentioned to you that I have an office dog. We actually have two
Mhm.
now. And that was something I researched before I did it. And all the research talking about dog-friendly environments and how it does decrease stress. And I think the university even brought in dogs at exam time, but it just is a wonderful addition. And sometimes people will come in and staff will come in and say, oh,
They're still
I'm
people. They're staff, but they're still people.
yes, exactly. Not just people off the street, though. I'm just
That's right.
saying,
I know what you mean.
I need to pet your dog. But staff will come in and
Yeah.
say, you know, I've had a stressful time. I just need some Mickey time, and they'll just snuggle with the big Bernese mountain dog, right? And
Wow.
yeah, and it kind of helps. So there's a lot of people do different things, right? But you know, we have a bulletin board where we post recipes and stuff, because some people like to cook for stress, and you know, there's just different things that people do. But I think that feeling connected and part of a community, we've had a lot of staff say that they like it here because they don't feel like they're just another number.
Yes.
And I've worked in big organizations where I've definitely just felt like nobody would know who I am, and nobody would care if I dropped off the face of the earth, right? Because it's just, there's thousands of you. And I really like that we look after people, that we care, and we, you know, we want to make sure that they're okay.
Well, I want to talk a little bit more about that, because at the start of the hour, you mentioned that this organization was created by a nurse herself. Can you tell us a little bit more of the origins? I think that's really interesting that, the compassion, obviously, that she felt in her role inspired this work in a bigger
Absolutely.
level. So
Yeah.
let's break that open a bit.
So I'm going to have to go back to the very beginning. So
Sure, by all means.
some people might be familiar with the name We Care Home Health Services, and that's actually who we are. We changed our name 2 years ago.
Right.
But We Care was founded in Brandon, Manitoba by a nurse, and it became a franchise-based system all across Canada. There was like 50 offices across Canada. And in 1993, a nurse here in Victoria, Renee Bradley, she
Mhm.
opened the business here. And she eventually sold it to a family, a local family that runs it now. And about 2 years ago, we were part of that network, and some of the franchises sold off, and eventually it was sold to a larger organization. And after a couple of years, we were like, you know what, we want to go back to our roots, and we decided to negotiate our way out. And so then we became Pacific Coast Health Services, right? But we're still the same owners, the same, it's not, Renee has retired now, but the family that I run the business for is a local family that owns the business. And they've owned it since I think 2006. And so it's all the same stuff. Everything's the same, just the name change, just a rebranding, right?
You know, for many people who have been listening to the program know that I am an advocate in Nanaimo, and I started the Origins of the Better at Home program locally. And what I wanted to share with you is that you have a team member by the name of Joyce here in Nanaimo. And I know, isn't she great? So Joyce, this is a shout out if you're listening. You know, I asked her actually to be part of this interview, and she was like, no, 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 I'm going to spread that on. But I
She's a
know
little
Joyce very
camera
well.
shy, I will say.
She is a spitball of fantasticness.
Yeah.
But what I loved about We Care, and of course now Pacific Healthcare Services, is that because the program that I was running was not just I, was our organization at the time, and still actually hosts that program. They We Care helped us set the foundation. The team that's local in Nanaimo came into my office. We sat together. We had a discussion about what was going on in community and what was being seen. And what I loved so much was the community advocacy that your organization has. And so I recognize that we're speaking to you from the beautiful, Victoria area, but Vancouver Island really has a lot of potential with Pacific Coast Health Services, being that you were where We Care at one time. And then I think you guys changed your name at one other point, or perhaps you belong to another organization, but frankly, I could never get that name right. I don't know why.
It's okay. It's okay. It's in the past.
So it's in the past. It doesn't matter. But what does matter is that the origins of the organization have not at all changed. But do you see the services shifting from when you started, or when they started, when you even began in your role? Have you noticed a shift in the last few years? And what does that look like?
Before, I'm going to backtrack a little bit, if you don't mind, because
Sure.
I'm super
Awesome.
excited. When we went out on our own to be independent 2 years ago, it was basically just the Victoria area.
Right.
And now we were so excited because we have just expanded to Nanaimo. So we will be providing services in Nanaimo as well. And we, because I worked so closely with the two previous owners of the We Care up in Nanaimo, and that's Barb Sadola and Joyce.
Of course. Yes.
And yes. So when they became available, we just jumped on it and said, hey, come work with us. And so they're going to be our care managers up there. And we're so excited because they are original We Care people, and it's like, it really feels like a going back to our roots, right? So
very much
all of that, those years in We Care, it was, we really cared about the people, and we just had this whole idea and concept, and it didn't necessarily fit with a corporate structure, but they have that same heart, that same feeling for how home care should be, and local, and independent, and so we're super excited to have them on board.
Well,
and
Barb is extraordinary as well, and I have great respect for both of those two individuals. I kid you not, they were so unbelievably supportive to me back in 2014. And, over the years, of course, so much has changed in our world as it is, and positions have changed, and different people are doing different things these days. But the clients remain the pinnacle and most important part of any of the work that we do. So let's talk a little bit about the clients that you have, because I know at one point with We Care, it was predominantly senior focused. I know that it's not anymore. What kind of people are you seeing these days? You mentioned something about paraplegics and all of that, but is there, like, let's kind of break that apart and open up that conversation.
Sure. Primarily, we're a private organization, but we also have a lot of contracts with other funders. So we have a contract with WorkSafe BC, and as you know, anybody can be hurt on the job, whatever age, right?
Yes,
we
for sure.
Also are on the ICBC preferred provider list. So anybody of any age can be in a car accident, unfortunately. And we have like public guardian and trustee, and there's other funders that will send clients to us, right?
Of course.
And then about half of our client base is private. So now, once you get into the private, just by virtue of the fact that we're in Victoria and we have such a high compared to the rest of the province, very highly rated for seniors. So it just automatically makes, our client base a little bit more higher rated to seniors, right?
Yeah, of course.
yeah, we will service, you know, anybody of any age that needs help. So it doesn't have to be, yeah, that, yeah.
So how do
We've
they
had
refer,
to-
how do people come to you? How do people, well, actually, this is a great segue because we're,
Sure.
you know, we're about halfway through at this point of our conversation. So maybe I should do some station identification, then we'll come back to the
Sure.
conversation a little bit more. So if you have just tuned in, thank you so much for tuning in to Act 3 on CHLY 101.7 FM. Always delighted that you are here. Thrilled that you tune in to us every Monday at 1 o'clock. So thank you again for tuning into the show today. In today's Zoom booth on the program, I have Twyla Johnson. She's with Pacific Coast Health Services, formerly We Care, and they have some really groovy stuff going on Vancouver Island. And so it's really important that you stay tuned in because we're going to come back to the conversation with her in just a moment. Having said that, before we do that, I do want to remind you of some things that are happening within community. There's lots of stuff that's going to go on this year that for the last 2 years we haven't seen very much of. It is my understanding that a limited version of the Silly Boat Festival may be coming towards us very soon. There's some limited things that are happening as well for general activities that are within our organization. So I do invite, not our organization, I'm sorry, within our beautiful, wonderful community on Vancouver Island. So do make sure that you check out Nanaimo and Voyager magazines and check out their website. Well, you'll find some of the most local things that are happening for each month as it goes by. I also invite you to definitely listen to Wellness Wednesdays with Teresa Osman and some of the other gang from our team. We love sharing information with you, so please make sure you tune into them as well. And don't forget to listen to Thursday morning, All About Your Money with our good friend Dale. So do listen there. But if you are listening to us on YouTube, thank you for watching. Please make sure you like, subscribe, and share if you like our content. We love it when you do that. It's such a wonderful thing to do. So thank you for that. And by all means, don't forget to tune in to Shaw Cable 4. Act 3 television comes out all the time. There's some good stuff on that program, and we might very well be showcasing someone that you'd like to see within community, a local friend or otherwise. So thanks again for tuning in. Once again, you're listening to Act 3 on CHLY 101.7 FM, and I am Kathy Holmes. Twyla is in the booth. Twyla, I know that there's a lot to share. Oh, I forgot one more thing. Speaking of sharing, one more thing is, everybody, don't forget, there's only a few tickets left for Shine 2022. It's the social event of the season, all for mental health and addictions. We're hoping to raise $100,000 for our community. I think we can do it as long as you show up. So please make sure you join us on that very wonderful event for September the 17th at 6:30 at the Convention Center. We can't wait to see you there. Sorry about that, Twyla, but I had to remember to send that out there.
Sounds
Twyla,
important.
it is important, actually. You know, anytime we're trying to raise money for whatever it is in this community, you know, funding now comes from a variety of sources, and private companies have to do a lot of work as well. And they support so much of the nonprofit agencies within community. And so we're always grateful for your support. Twyla Johnson from Pacific Coast Health Services is here. And since we're just at that point, I should also remind people, go grab a piece of paper and a pen. You're gonna want to write down her information, and we'll share that with you in just a moment. So tell us more, like, why do you love this work so much, Twyla? Because this is pretty cool stuff. Why do you love it?
I kind of joke that I might be ADHD. I don't know, because I just love the multitasking, and and I joke that my job is actually, I'm a firefighter. I just run around and put out fires. But
Yes, you're a
I
hero
love
though to do that, because that's amazing stuff.
I
Go ahead.
love serving the community, and community health has always been my love. When I graduated from nursing school, I went to McGill up in Montreal, and I moved to New York, and I worked for a health department in upstate New York, which was really interesting, and got to do some fascinating stuff, and just working within the community, and you build relationships. I did do a short stint. After that, I went to Baltimore and Washington, D.C. area, and I worked at Johns Hopkins. And I liked the hospital, but it's like people are in and out, and you don't really build those relationships like you do when you get to know people in the community and you have a caseload. So I really missed that. So I went back to the health department, and I was there during 9/11. And so I actually got to learn a lot about emergency preparedness, and dealing with potential bioterrorism events and things like that.
Of course.
It was really interesting to learn how to make quick decisions, to prioritize quickly, and how much a community can quickly change in a crisis. So, I mean, 9/11 was a huge crisis, you know, living outside Washington, D.C. And COVID has been another huge crisis. And it's all about pivoting and not being, when you're working in the community, that's one of the things I love about it. It's like something that might be hugely important this year is like backburnered next year because something else is more important, right? And so having the ability to adjust and change, I just think it's fascinating, and I wouldn't do anything else. I love it so much.
Well, you know, and it's radiating off of your voice. I can hear just every part of you that is just feeling so, you know, it's a beautiful feeling, a beautiful strength that quite obviously you have. But you did mention a couple of things that were tweaking some interest on my part, because we don't really think about bioterrorism as much anymore since 9/11 took place. But that's not far off of the horizon. And some of the things that when we think about bioterrorism and we think about, you know, the COVID response and the emergency response that had to go with that, did you see a similarity between what was happening in 9/11 and what was happening with the potential of bioterrorism, and now with COVID and the craziness that went with that? How similar really are they?
Well, then we're going to go back to my therapist brain, right?
Yeah, let's do it.
The biggest thing I noticed was the fear response. And there was so many similarities there with the absolute panic, like what's going to happen in 9/11, what's going to happen next. And I don't know how much you guys heard here, but where in DC where we were, people were wrapping their house in plastic, right? It was just, they were so afraid of any, you know, I got trained how to give the smallpox vaccination, which is unheard of because it's not in the wild anymore. It was only as a bioterrorist event. So just like there was government response trying to be immediate, but also confusing because you're trying to figure out, especially day of, because it's hard to know what's happening and teasing that out to when is it over and what's next. And that was very familiar for me.
I bet.
Of course, COVID was a bigger example of that, but you still had you know, you get people sitting in a room where one was like, I'm ready to put a bag over my head and tape it off.
Yeah,
because I'm
no,
terrified.
that's so true. There's
And the next person is like totally in denial and like, that don't be ridiculous, it's all taken care of, right? So and then everything in between, and you kind of have to respect what I actually look at both of those people as coming from a place of fear. Like sometimes people will be in denial because they're too afraid to deal with it.
Yeah, I couldn't agree with you more.
But everybody has their reason for where they're coming from, right? So it was interesting to see people trying to sort through that. Yeah, it was very similar that way.
I had friends that passed away actually at 9/11.
Oh, I'm so sorry.
I mean, I went back to New York for my I want to say 5 years ago that I was in New York. And honestly, they've done a beautiful job of creating tribute to it, which most people know about now. Is like there's a beautiful tribute to it, but you can't help but feel when you're on those grounds to feel a sense of deep sorrow and deep confusion and all of that. But I really empathize with what it is that you're saying regarding, you know, that fear and, you know, wrapping your house in plastic and, you know, people that I know here with COVID, there were some, and we hardly saw it compared to where some of the communities that were heavily impacted, you know, that fear was people not wanting to even go outside. They weren't wanting to touch a bag. They weren't wanting to do any of those things. And so we started to see an uprise of mental health issues as a consequence of all of that. And how are you, is mental health something that you're seeing on the rise in the work that you do on the ground every day?
As in our client base, not necessarily on the rise. I mean, we've always had a certain aspect to it just because, you know, we're a little microcosm of the bigger macrocosm, right?
Of course.
So it's going to be reflected. I think I will say I could see it in the stress in my coworkers and the staff that work with us. people are okay, so they're going out to your home and they're a professional and they're coming and they're doing their professional thing, but they also have their own lives with, immune compromised children, or a very sick mother, and that worry about what if
Yeah.
they want to go out and help you because they've become attached to you,
Yeah.
but what if I bring something home to my mom, or like it was so
Yes.
complicated. And then then the stresses that are just always there, financial and just everything, and people with spouses, losing
Yeah.
jobs because
Yeah.
stores were closing, and it was just it was a lot. It was a lot. People went through a lot, and are still doing so.
Yeah, no, and it's changing too, because with, gas prices and all of that stuff
The cost of living is
rising, cost of
ridiculous.
living,
Yeah.
it's,
Yeah.
even people that aren't normally impacted, and I don't mean to be disrespectful about that, but there's some people that have much better financial positions, some secure positions,
Mhm.
and they are noticing the crunch as much as anybody. But then those that are already in some real crisis financially, and they're having to choose even more than ever before, cat food
Yeah.
over food and substance. But, taking that aside, I mean, I realize that we are not in a position, no matter what organization you're with or what company you're with, we can't, fix all of the ills, but we can be proactive in supporting people where they're
Mhm.
at.
Mhm.
We know that, the heat dome last year, was pretty scary for a lot of seniors and
Mhm.
community. Did you get a few extra clients as a consequence of that, right? Did you find that your numbers went up when the environmental changes started to hit in Victoria specifically?
Mm,
Because I know it's fairly new here, but
yeah. No, I didn't actually, don't think
okay,
the heat dome raised our clients base. I know that, there was concerns, but I think everybody kind of weathered the storm that way. Yeah.
terrific. Yeah, I know. Again, it's a little far-fetched, but I think that that's the worry for a lot of people this year
Mhm.
too, is, who do I turn to? Where do I go? What do
Mhm.
I do now? Particularly if fear shows up in their world, there are
Mhm.
solutions that can happen, and so it's important
Mhm.
that people stay connected for sure.
Mhm.
So the people that you have working with you as a team, I can only imagine their skill level must be pretty extraordinary
Oh
to
yeah.
be able to. So can you tell us a little bit about your team
Oh, we
without
have a
the
great
people
team.
necessarily, but just some of the people as it goes? Yeah.
Yeah, well, our office team that supports everybody out in the field is really the backbone, right? So even though our staff are working alone,
Yeah.
they always have access 24 hours a day, 7 days a week. They can pick up the phone and they will reach someone, because we always have a scheduler on call, we always have a nurse on call, and I'm always on call for anything like that has to level up to management, right?
For
And
sure.
so they're never alone. So, and in order to have that work successfully, you have to have a cohesive team that works well together. And I have to say, we really do. I love it. We celebrate together, and we everybody gets along. It's crazy. It's wonderful. They're respectful, and their knowledge base is amazing. So I have two managers. One is currently off on leave right now,
Uh-huh.
but the one that's here, she is an expert in spinal injuries and wound care. And we have a couple of other nurses, like 1, 2, 3. We have one or two that do foot care. We have all of them do wound care, like amazing wound care. And the beauty is they're interested in it, and they go for trainings. Like my manager, her name is Avalon, and
Mhm.
Avalon and I went yesterday to a training up in Nanaimo that was fabulous, all about like compression stockings and these really fancy ones, which are amazingly helping people.
That's
So I
great.
just love that they're constantly learning, and they are respectful, right? So
Yeah.
they never treat any of the other staff that they're supporting like like they're inferior, or like falling them out, or like it's
Yeah.
all about a respectful work environment, right? Being treated as the professional that you are. And that's our policy, is like, you know, good customer service. And our first customer in the door is our staff, right?
Yeah, yeah,
Because if you don't
absolutely.
treat the staff with respect, then they go out and they don't treat the customers with, so it
That's
kind of
right. That's
seems
right.
like a no-brainer, but they are super successful at it. And so we always have lunch together and just, you know,
Oh, I'm
um,
so glad.
sometimes
That's
we
great.
laugh a little bit too much, but that's better than not at all. And
Are you
so
kidding? Laughing
that's
too
the
much is
biggest
the bonus. That's the
that's
bonus.
the biggest stress reliever. Laughter. Absolutely. It's like some of the things we laugh about you would shake your head, but honestly, it's like decreasing the stress right away. And so it's like, okay, now I can go handle it.
And I think that for the participants that you have as your customers, you know, they probably really appreciate the value of the humor as well. You did mention something about foot care, and I know a lot of older adults on Vancouver Island. One of the things that is really comes up for them all the time is foot care. And so can you talk a little bit about your specialized programs that might, you know, address some of those more, you know, maybe not full wound care, but it might be other things that are of relevance and importance to them as well?
Well, I would say one of the best parts about our foot care nurses is that all of our foot care nurses actually do wound care as well.
Oh, that's
So
great.
when you look at the anatomy of a foot, and if someone's having difficulty with their feet, a lot of times they might have diabetes or other neuropathy that will affect blood flow, nerves in the feet, that kind of thing,
Mhm.
and might lead to wounds in the feet, or what might be progressing towards a wound, but you wouldn't recognize, but a wound care nurse would, right? So
Yeah, for sure.
um, uh, the beauty of having them double duty it, so to speak, is it's interesting for them because it's not the same thing all the time. And it kind of crosses over, and it helps, you know, their skills in both.
Yeah, for sure. And this is in-home care services. So just a reminder, people, can they do either? Like they can come to you for service, or for the most part, do you go to them?
For the most part, we go to them.
Yeah,
We do have a couple of facilities that have asked us to come in and do a clinic in their, you know, in their facility with their
sure.
clients. And
Yeah,
that's
for sure.
always something that we're open to. But most people like us coming into the house and doing it there. And it's,
Yeah.
yeah,
Well,
it's
there's
easier
something
for
to do.
them.
Well, it's easy for them, but there's also that
Yeah.
beautiful personalized conversation, right? Like it becomes
Mhm.
it becomes a bit of a social at the same time as it's, you know, looking after those very essential and important matters, right?
Yeah. And I
Yeah.
will say that's what the nurses say too, when they're one-on-one working on a person's feet and chatting with them, it's an opportunity. You've got a nurse right at your feet.
Yeah, no,
And you
no,
can ask
right?
all these nursing questions. By the way,
That's right. By the way,
what does it
yeah.
mean when my blood pressure is this? So
So
yeah, people like it for that too.
they do. So like I think it's really important. We have told people to go get a piece of paper and a pen. So we should maybe give them some information
Sure.
about how they can reach you. But also maybe just to sort of like give people an idea of some of the services that are, you know, like call, find out whether or not some
Mhm.
of these wonderful opportunities can happen in your home by a nurse from
Mhm.
Pacific Coast Health Services.
And our nursing care managers will go through what the needs are with the person that calls. Because sometimes when you call, you're not really sure what you want. What do you have? Like, you
Exactly.
don't want someone to just give you a laundry list of everything they do. Basically, our nurses will ask what's happening. What, you know, what do you think they need? And then we can kind of talk, well, this is what we could do. So to give you a rundown, to give you the laundry list,
A laundry list.
is we do things like just we do companionship, for example. If you just want,
Yes.
if you want someone to come in, say your parent or is in a facility, but you don't feel like they're getting enough stimulation, or they need to get out for walks but not by themselves.
Yes.
We have workers that can go take them for walks, have play cards with them, make them tea, you know, that kind of stuff.
Yeah.
Yeah, we do accompanied visits, so we can't transport, and that's got a lot to do with new laws, ICBC and Lyft and Uber
Absolutely.
coming in. So they
Yeah.
get really a little bit twitchy about people getting paid to drive people places,
Yeah.
but our workers can go in a cab or by handy dart or on the bus, however you would like your loved one to go. They could take them to doctor's appointments, you know, if they can't get there alone, or go to visit friends, that kind of thing. We have had people say, you know what, my dad is terminal. He's got 6 months. He used to love to go to the casino every Friday. So we had a worker take him every Friday to the casino, and he
Oh, no, no, that's
gamble. And
great.
it's like, you know, finish living his life the way he lived it, right?
Yeah, on his
So
terms.
yeah, absolutely. So anything like that. We also then get into actual hands-on caregiving, where our workers can go in and, you know, bathing, dressing, helping with meal prep. We are not a cleaning company, so we don't do a lot of cleaning, but we can do a little bit. You know, we can throw some laundry in, we can vacuum, you know, that kind of stuff.
Sure.
Especially if we're doing a bath, obviously we're going to clean up the bathroom after we, you know, have a shower have someone have a shower. So there's that. And then we have care aides that are on the registry that can do even more complex care. So that's where you get into people that have real severe medical needs, like, you know, catheterizations, you know, the catheters need to be changed, and different different medication assists, that kind of stuff. And then you get up to the level of the nursing, where you can have nurses going in and doing nursing tasks, more medical things and oversight. All of our workers, caregivers, are overseen by nurses. So we do keep an eye on what's going on, and they make the care plans, and so to make sure that everybody's doing things according to the client's safety and best interest, right?
Yeah, I love that there's such an expansion of what it is that you can do, because I know that for some people, companionship is really what they need. But people change, you're right? They stay with you,
Absolutely.
and then that can evolve so very quickly. And so to be able to have people, eyes on people all the time, right? To be able to support those changes makes all the difference in the world. Yeah, for sure. Okay, so how do people call you? Do they phone? Do they email? Do they website
all of
you?
the above.
Oh, I knew they would. Go ahead and tell us.
I would encourage people to check out our website. So that's www.pacificcoasthealthservices.ca. And you can reach out to us through that. Our phone number, if you want to reach us directly, is 250-389-0202. And that is the number for both Victoria and Nanaimo. So we, because of that's one of the pluses of COVID, was that we all learned how easily it is with technology to reach out electronically. So we didn't need to actually have a physical office in Nanaimo, which wasn't, it would have just been an extra thing.
Yeah, totally understand.
So it's much more,
that plays a role in the cost effectiveness of it all too.
It absolutely does, and allows us to keep costs down when other things are rising, right? So so if you're in Nanaimo, just dial that same number and we can get Barbara Joyce to reach out to you, and they're amazing. You'll love them. And then we also have,
and I can tell you for a fact you will love them. Like I can tell you for a fact, they were extraordinary supports and still are. I mean, I saw Joyce very recently and I was like, you haven't changed a bit, you fabulous woman. It was so great to see her. Yeah, no kidding. So
we also have a general email. Do you want that?
Okay. Yes, please.
Okay, so it's just info@pchservices.ca.
Perfect. And we're going to give those out one more time before we end the program. But there is something that I love to do as we start to close the program, because I know that, you know, we're starting to lean in and we've talked about a lot of stuff today. And I could probably talk to you for 3 more days. I'm enjoying our conversation so very, very much.
I'm loving it too.
But I'm curious, right? Like I always have this curious place. It's that life lesson learning thing that I like to imbibe on all of our communities, because we learn so much from people like you. So if you were to inspire or imbibe a piece of knowledge from your experiences in doing what you're doing, what might that look like for you?
I am very into the concept that we create our own reality. So I would encourage everybody, as both a nurse who's seen a lot and as a hypnotherapist who's quite into the subconscious and how powerful it is in the programs that run in the background for us. There's a famous quote, I can't remember who it was, but whether you think you're right, things are good or think things are bad, you're right. Because however you put it out there, that's basically what our reticular activating system, which is the part of our brain, will look for. So if you say to yourself, I'm always sick, or people hate me, that's what your brain is going to look for. It'll notice that. But if you say, you know, I love life, and you try and you make baby steps, right? Or maybe I'm just going to have a good day. That's what your brain is going to look for. Those are the things that will, I want to say, be attracted to you. Makes it sound like law of attraction, which is not really what I'm talking about. Not that I disagree with that either on a certain level, but it's like when you buy a new car, if you buy your a Volkswagen Beetle, then suddenly you see them everywhere. That's your reticular activating system at work. And it's trying to basically just always beef up your beliefs. So make your beliefs good ones, right?
Yeah.
That's my advice.
I think that's incredible advice, because I agree with you. I think it's true. I think that there's a lot of people that are looking for the negative. They're looking for the stuff that causes them so much pain. And if they flipped that lid and maybe looked at it the other way and saw the world from a different place. I used to, friends of mine have always bugged me about this, and I love that they bug me. But as you know, I'm not going to change. I adapt, I evolve. But I've always had a pair of rose-colored glasses. I won't deny that very often that my rose-colored glasses are a little bit bent or quite crooked at times, right? Get a little bit beat up. But I would rather believe in the good than believe in the bad, because we can all get lost in all of that negativity.
Absolutely. Our thoughts have momentum to them,
They
right?
do.
So if you start thinking, that's when people call it their monkey mind gets going, is because you start thinking about something. What if that bad happens? And then what if that? And the momentum goes, and then suddenly you're lying awake at night going, everything's going to hell.
It's so true.
That momentum can actually happen the opposite way. And a lot of people don't realize you can actually gently rein in your thoughts and put them in a different direction. And I'm not saying put your head in the sand. I'm not saying anything.
No.
I'm saying that you can choose how long you ruminate on something bad, right? And okay, enough. Now I'm going to think about something wonderful, like how soft my dog is, or my kids' laughter is pretty awesome, right? And that kind of thing, to just, because you want to live a good life, you want to live a happy life, and you
Absolutely.
Yeah. And you do have control over that. And you do create your own reality. And I could get into quantum mechanics even, but I'm not going to.
That's another show. That's another show. But I definitely think that we should get into that at some point. And so I really appreciate you joining us today on Act 3. Thank you so much for your wisdom, Twyla. It's been so great. One last time, how would you like to give out your information for our listeners in case they didn't get the piece of paper and the pen when they were supposed to earlier? I'm sure they've got it now.
I will do the phone number as the priority, because we have someone on call 24 hours a day, 7 days a week. So anytime you can reach us, and it's 250-389-0202.
Thank you again. So it has been a privilege to have you on the show. Thanks for tuning in, everybody, to Act 3 on CHLY 101.7. It was so much fun. Twyla Johnson, Pacific Coast Healthcare. Don't forget, you can reach out, you can call her. And if you are listening to us on the YouTube station, I will make sure that that information is in the box below. So be sure to check it out and see how you can be benefited by Pacific Coast Health Services. Thanks again. That does it for us on Act 3. Have a good one. Thanks for now. Bye.